I think, Vikash, you have an underwater case. You want to show it now?
I do, yeah, sure. Yeah, just some background. This was an 8-year-old patient with comorbidities, ischemic heart disease. He's had stents before. He's had 3 previous colonoscopies, and this lesion was found at the sigmoid area, rectosigmoid area. First attempt, they tried to do an EMR. Second scope, recurrence. Tried another EMR. Third attempt, recurrence again, and they just biopsied the lesion. And so that's the background for the patient. And I'm just going to let it play for a bit, and then it's not too long, so maybe we can have a bit of discussion afterwards. But let's just let it play.
My first comment.
Very similar,
maybe,
yeah.
Maybe, can you pause it? My first comment is anyone worried about that lesion? So yeah, I think this is a classic false blink. Okay, so this is a classic